Hey, that looks better. I think we're recording now and going live. Hi, everyone. Hopefully you can hear me. My name is Gia Drew, and I'm the program director at EqualityMaine. And I'd like to welcome you to Zooming with EqualityMaine, our series on topics relevant to the LGBTQ plus community. And my pronouns are she, her, and hers. We have a really important show for you today. It's about the intersections between HIV, AIDS, COVID-19, and race. We were planning this program for, I believe, last Tuesday, but out of respect for Blackout Tuesday and the current situation and interest and energy about the crisis around racial justice that we were all sort of involved with, we decided to push it off to today. We know that many members of our community are struggling and are facing all different things and related to HIV, COVID, and race right now. And we think this is a really important topic to talk about. So we want to make sure that we had the conversation today. We have a bunch of wonderful guests with us as well. And so I'm glad you're joining with us live on Zoom. And so we have looks like we have many participants in our Zoom webinar today. If you have questions throughout the webinar, please use the Q&A participant areas. We can ask some questions for us. We have folks working behind the scenes to ask us questions. And if you're watching live on Facebook, you can also ask us questions in the comment bar. We have people watching that as well. So welcome to folks streaming live on Facebook from Sage, Maine, EqualityMaine, Equality Community Center, and Frannie Peabody for this show. There's some logistics there. So like I said, today is the intersection of a current health crisis, COVID-19, HIV and AIDS, and race. And you know, I've been thinking about this since I first learned about the pandemic back in probably January, February, having been affected by HIV and AIDS throughout much of my life and the government's response to COVID-19. And I was very curious how other people were feeling about it and reacting to it. And so this has been in my thoughts for many months right now. So I'm glad we're having this conversation today. So we're going to break today's conversation into two parts. The first half will be more or less about the current state of affairs here in Maine and across the globe related to HIV and AIDS, COVID-19, and race. And we have three guests for that. And then the second half of the show will incorporate some other guests where we'll look back over the last 35 years on the HIV AIDS movement and see what is similar and what's different today. So let's get started with the introduction to our first set of guests. I'd like to welcome Katie Rutherford to our show today. Katie is the executive director at the Frannie Peabody Center, Maine's largest community-based HIV/AIDS service organization. In addition to wraparound care for individuals living with HIV and AIDS, Frannie performs free confidential HIV and hepatitis C testing services to over 700 individuals annually. So welcome, Katie. Hey. Our next guest this afternoon is Tiffany Townsend. Tiffany is a nurse practitioner at Maine Medical Center's Gilman Clinic, and who treats hepatitis B, hepatitis C, HIV, and substance use disorder, in addition to providing PrEP, which is pre-exposure prophylaxis, and PEP, which is post-exposure prophylaxis, to those at risk at acquiring HIV. She is certified through the American Academy of Nurse Practitioners and earned her HIV specialist certification through the Academy of HIV Medicine. Well, welcome, Tiffany. We're glad you're here. Great. We're really excited to have Theo Greene be part of the show today as well. Professor Greene joined the faculty at Bowdoin College in 2015. His research, writing, and teaching interests lie in intersections of gender, sexuality, urbanism, and culture. His research broadly uses sexual communities to understand how urban redevelopment shape and configure how individuals conceptualize, identify to, and participate in local communities. And there's a long list of things that Theo is part of. So we're really happy you're with us today, Theo. Thank you. So why don't we get started with the first half of the show? And, you know, I guess we can start really broad and then get a little deeper into this. And, you know, I think we're going to start with Katie, if you don't mind, a little bit. Katie's the director at Frannie Peabody. And why don't you give us a little snapshot of just, you know, when I started learning about HIV and AIDS back when I was in probably college in the mid 80s, there was a lot of information or very little information about what was going on. I bet a lot a lot has changed in the communities you're working with. So why don't you give folks just a little snapshot of what's going on today with Frannie Peabody and the HIV/AIDS community?
Sure. So thanks for having me. So Frannie Peabody Center provides comprehensive services, wraparound care for people living with HIV. So that comes in the form of case management services, housing assistance, behavioral health services, and then our prevention services through HIV testing and hepatitis C. Those programs really are the result of years of advocacy, particularly from the early days of the HIV/AIDS epidemic. We're very lucky to have programs through HUD, our housing assistance for housing opportunities for persons with AIDS is what the program title is. And so we've been able to really address the unique needs of people living with HIV, toward the goal of remaining adherent to life-saving medication, which also eliminates the risk of HIV transmission. So we started off as an organization that was doing as much as we could as the AIDS Project before the effective medications existed, and then also opened Peabody House, which was a hospice care facility in the mid-90s, and then following Frannie's death in 2002, we merged to become Frannie Peabody Center. And because of the effective medications and the decrease in demand for hospice care for people living in late stages of AIDS, we were able to close Peabody House in 2009, but still offer a form of housing assistance through that federally funded HOPWA program. And currently we've been able to receive emergency funds through several local organizations, but also additional funds through the CARES Act, right, to be able to provide extra housing assistance and quarantine assistance. And we've been able to kind of pivot the way we were delivering services so that most of our staff is working from home, but we still have a few people in the office to help facilitate applications. So we were able to continue services relatively smoothly and be able to get emergency assistance out and masks and things like that. So that's kind of where we are.
So tell me a little bit, Katie, of like some of the initial questions some of your community members are having about the intersection of COVID and HIV and AIDS.
I think initially one of the biggest questions was around medication shortages. There was some news pretty early on that a lot of the medications that are used to treat HIV could potentially be useful in treating COVID, and that word got out pretty quickly. And also one of the largest HIV drug manufacturers started working on a medication that was being tested, and so there was just a question of demand and what that could potentially do to the HIV medication supply chain. That in addition to kind of figuring out, we shut down so quickly, especially where people living with HIV had questions around, even if their viral load is suppressed, are they still at higher risk for COVID, and what does that look like? And unfortunately, we weren't able to answer a lot of those questions. We definitely relied on people like Tiffany as the medical provider to help us navigate that with clients, and tried to stay in really close contact with the drug manufacturers and the Maine CDC just to make sure that we could help people navigate those challenges. But definitely, I think medication and risk were the two biggest topics in the beginning.
Right. Thank you, Katie. So you brought up Tiffany and the work on the clinical side of this. So Tiffany, let's bring you into the conversation. If you want to unmute yourself, there we go. So what are you seeing at the Gilman Clinic in terms of the patients and clients you're seeing and the questions they're having?
We had many of the same questions that Katie just mentioned, largely around medication shortages. People don't want to run out of their HIV medications, of course, and shortages as far as the pipeline, what's coming through the pipeline, and will I be able to get enough? Can you give me a longer supply so I can have more medications at home? Navigating insurances and those sort of issues to help people make sure that they were comfortable with what they had available to them. And then people who were not on medication. They wanted to know what their risk was, if their HIV was uncontrolled or if they had advanced HIV because of, am I at a greater risk for complications? Am I at greater risk of acquiring COVID? If my HIV is not well controlled, all the way through, my CD4 count is very, very high, and my HIV is well controlled. What are my risks? And that was a huge concern for folks. Today, so jump forward a few months, what I'm hearing is a lot more anxiety, depression, insomnia issues related to isolation. I'm seeing and hearing from folks who have relapsed from sometimes many years of sobriety.
Wow.
With their substance use, because there's just a lot of anxiety and fear and uncertainty, and people are missing connections. And we know that we work with an at-risk population for mental health issues and substance issues already, and that's what we're seeing a lot of now, 3 months into this.
Right. I definitely understand that. We've been hearing that too from our community, really struggling with some of the mental health issues of being isolated and disconnected from community members, and that contact, that intimate personal contact that we need as humans. And so that's been really hard for many folks. I know we had talked on a previous call a little bit about folks who are on PrEP or on PEP, about some of their concerns or questions about continuing that, not continuing it during the COVID. Have you been hearing that as well?
Yes, we have a number of folks who have asked. So PEP, we want to get people on that and keep them on that for their 4-week window of time that they need to be on that. And people are generally pretty good about that once we explain it to them. PrEP, however, there's a lot of concern or a lot of questions around, are people still hooking up? Is there, are the apps still active? And we're hearing that they are. And some people have wanted to go off PrEP. Some people want to stay on PrEP. Some people want to do more of an on-demand PrEP. And I would say, stay on it. If you feel that you've needed it in the past, then now's not the time to go off it. It takes time to build back up in the system. On demand can work for some people, but talk to the person who prescribes it for you before you go there. And for those that are still sexually active right now, then I would also encourage continuing to check for sexually transmitted infections, because we know that they're out there and they need to be treated. And lots of primary care, the STD clinics, people are still available to treat those things, even with a lot of medical shutdowns.
Yeah, no, that's a really important point, Tiffany, is that I think we're, in addition to this conversation on getting tested for STIs or other things, I think a lot of folks have just foregone getting help on medical conditions. They've just been worried about going into clinics or hospitals, or they've thought COVID's more important than what I'm dealing with right now. I can just wait for a month or two. And I think we've seen and heard from hospitals that their numbers are down and their clinics are down. And I think it's as you said, people should be getting tests and should be seeing they're calling their providers. And if it's life-threatening, go to the emergency room, which is, I think, a message we want to get out to people.
Absolutely. We know that across the country, the death rates have, certainly we've seen a lot of death in the last few months, and death rates even from things not COVID related have increased because people have not sought care when they need to. And so it's a very important message to get out there. I can only speak to what we're doing at my facility, but there are a lot of precautions that are being taken to keep people safe as they're coming into a facility, whether it's to get labs done or screening tests done, or treatment for illnesses and diseases. And so trust those processes and call if you're not sure what they are, and find out.
Sure. Yeah, exactly right. Thanks, Tiffany. I'd like to turn to Theo. Welcome, Theo, to our show today, or our program. Chris always makes fun of me when I say this is a show, but it's a program. So I'm really grateful you took some time to join us today. And I'd love to ask you a little bit about what was going on, in conjunction with your work and your activism and your research when we started to learn about COVID and how it was affecting communities across the world and here in Maine, what were some of the things were most important to you?
Particularly, my major concern was thinking about in a world where African Americans and poor communities already have barriers to accessing proper healthcare, what the impact of COVID is going to be, right? And so we now see African Americans in particular, because they're also working in the front lines. They're, oftentimes when they seek medical care, they often rely on emergency rooms as opposed to primary health, physicians and that sort of thing. That they're dying and contracting this at disproportionately higher rates in other communities, right, relative to the population. And I think, when you add to that, then these questions of pre-existing conditions, you add to that, again, I think, HIV in particular, as we also know that, almost 50% of new cases are from African Americans as well, right, with that higher proportion being women. And you think about the fact that, if African Americans are relying on emergency rooms that are now shifting their priorities in a system that doesn't necessarily believe, people of color when they are having symptoms and everything else. It's a perfect storm of a whole slew of problems and issues that remind us about the inequities in our medical system, right?
Right. Yeah, no, that is so important. And I think about it, and I think about the response from not just the health community, but the government, and how they're messaging and talking about this. And I wonder, Theo, if there's something that communication is lacking that you would suggest to make sure that we're reaching communities that aren't probably hearing it, or what does that look like in terms of how do we reach communities that aren't getting the message they need to hear?
That's a very good question. And I think it's a very complex one because, again, I think the messaging doesn't necessarily mitigate the fact that there's still barriers for these communities to access proper healthcare if they need it. We again, I think in many impoverished communities, right, there are barriers to getting to hospitals and facilities. I know when I lived in Chicago, there was discussion about how on the south side of Chicago, it can take up to an hour if you were relying on emergency services to get to the nearest hospital. And if someone had a gunshot wound, right, in a place where, gun shootings was an epidemic, right, that's virtually a death sentence. So again, it just reminds us about these enormous barriers. And so I think we have to think more broadly about these systemic changes, right, that are now, I think, becoming or intersecting with other kinds of discussions we're having in the world right now in terms of racism. We have to sort of spill that into, I think, healthcare, and again, how to get people the proper access to not just, healthcare for these larger things, but also preventive care. So give them a greater sense of responsibility. It's not a question of responsibility, but it's also making sure that there is enough resources to go around to help these impoverished communities.
Yeah, thank you. That's really helpful. Katie, I want to ask you a question a little bit. I know you've been in this work for quite a while, and if I remember correctly from reading about your history, that you spent some time working in South Africa. Is that right?
That's correct, yeah.
I think the conversation on HIV and AIDS for many of us has sort of been originally the USA focus and what was going on here, and then looking at Africa and how Africa and different nations in Africa was responding, and now, looking at the intersection of folks who are now coming to Maine as new Americans and what that looks like in terms of, response to HIV and AIDS, but also COVID. I wonder if there's some type of conversation you're having or have thought about in your role at Frannie Peabody.
So we have a growing population of asylum seekers. That population of our clients has been growing since about 2009. And so we've tried to evolve and adapt to make sure that our services can meet those needs to the best of our capacity. And so that has involved phone interpreters when possible. And as you know, in the state of Maine, we've got people coming from many different countries and different cultures and with different languages, and bring so many different challenges that they're facing. And so trying to be a system that supports navigating those challenges can be really difficult depending on the resources that we're able to have access to. We, again, because of a great deal of advocacy, we have programs like the Ryan White Care Act that can connect people to health insurance regardless of immigration status, which is huge. And as well as the federally funded HOPWA, the housing grants that we administer. And on the prevention side, we also work with the Maine CDC to do minority health outreach. And so we partner with organizations like Maine Access Immigrant Network and Wabanaki Health to make sure that we're reaching as many different populations as possible in the most effective way. And it's so important to work with those community partners because of the diversity of Maine communities. If we had a French-speaking prevention staff member, that would still present challenges. We really need to be able to work with partners that represent the communities that we serve. So those are some of the areas that we really try to stay involved and engaged in order to best meet the needs of those populations.
Yeah, thank you. You know, Tiffany, I was thinking just a little bit about how people responded to HIV and AIDS back in when I was in, in the 80s and 90s, and, I'm looking at how COVID was sort of approaching really quickly, and people started quickly equating the two things, like these are the same things. But we know they're different. Can you want to talk us through a little bit on the clinical side, how very different HIV and AIDS is compared to the COVID-19?
Sure. I think, before I jump into saying how they're different, there are similarities just from the fear, the stigma, how does it spread? How is it on surfaces? There's a lot of those sort of questions that certainly came up, many, many years ago. But the differences obviously are very, very different as far as, one being a life-altering long-term disease that's now manageable, but we didn't know how it would be many years ago. And, even that's a similarity sometimes that comes up in as far as, we're trying all these medications, and long-term survivors of HIV certainly know what it's like to, try this pill, stop this pill. We want you, your numbers are good now, so we're going to have you stop. Oh, your numbers have fallen, come back on. There's all of those sort of things that took place many years ago, that uncertainty for some long-term survivors is really striking a chord for them. But as far as the differences, we had HIV is an illness that affects many parts of people's lives. It affects the entire body. Certainly the social stigma that has been around with HIV is prevalent. It hasn't gone away, although we are making strides and changes in that. And as we learn more about HIV and how it affects one's body and one's social sphere, then we're able to, help people, I'll say, help people move, just lost my train of thought. We'll have them help them, accept the diagnosis and move through it, and how to live long, healthy lives with it.
Yeah, yeah. I mean, I've been thinking about that too, is what we've learned about, being safe or safer practices, as living through and being part of those communities. And so I know I've learned a lot about how to interact and proceed with caution as much as possible. So I do think our community members have been a little bit more adept to rolling into COVID a little bit, just because of our ongoing practices in life that we've had to live over the last 30 years. So Theo, I'm going to come back to you a little bit, talking with Katie a little bit just about sort of what's going on. And I know over time, the relationship between race and first HIV and AIDS. And so what were some of the barriers for folks in those communities to, when getting care? Are there still, as far as you know, some substantial barriers for folks in terms of the racial component to talking about being part of, whether they're part of the LGBT community or not, just the intersections between race, being LGBTQ, and HIV and AIDS, right? Those are like three very different things, but they can intersect in very, unfortunate ways sometimes.
Absolutely. And, the relationship between, I think, HIV and AIDS and the African American community is fraught and complex. I mean, from the very beginning, you know, of the epidemic, we saw that African American, the primary institution being the African American church, seeing HIV and AIDS and homosexuality as this white disease that's infecting the African American community, right? So, you know, it wasn't until, you know, we began to realize the other ways in which people could get HIV and AIDS, particularly through intravenous drug use and et cetera, that the African American community then became, it raised greater alarm. But at the same time, you know, even when African American communities began to start mobilizing around it, I think in some ways that information about the drug use, and particularly during a crack epidemic, right, that was often impacting inner city communities, right, it only served in a lot of ways to increase the stigma often attached to HIV and AIDS. That often, I think, made it very, very difficult to be able to do more effective advocacy and create greater awareness, right? If we're thinking about this as a pathology as opposed to people that really need care. And I think over time, particularly as we saw a lot of interventions now coming in that would help reduce HIV transmission and help allow people to live longer with HIV and thinking of it as a chronic illness, we now see various ways in which it's kind of an ebb and flow. So within African American communities, as we're beginning to raise the alarm, we often are now seeing you know, the rest of the movement sort of moving on to other priorities in some ways, and that produces a sense of alienation among African American communities who are trying to fight this. And so I think, you know, we're still thinking about stigma, we're thinking about isolation. Again, the fact that there's still, you know, we still have such a high preponderance of it in the African American community, the fact that so many people are living with it and don't know, right, they're not getting tested. Right. Still, I mean, it highlights, again, the sort of complexities of what the stigma of having HIV. And in particular, given the fact that so many of these new cases are African American women, right, that are, you know, are getting it because of boyfriends that are engaging in sex with other men and not using proper protection and not engaging in those kinds of safeguards that we know can sort of reduce transmission. That continues to also produce stigma around homosexuality within the African American community as well. And so, you know, again, it's really challenging to sort of disentangle all of that. But we are, I think, within the African American community, within communities of color, we are beginning to raise the alarm more. We are beginning to try to do more and fight more to get people the proper testing, to give people the proper knowledge necessary to be able to live with HIV.
Yeah, no, I think thank you, Theo. That's really helpful for me to hear that, and to, you know, I was watching something last night and just thinking about what's going on right now with Black Lives Matter and racial justice, and recognizing that that's a real health crisis, right? That is a health crisis in addition to COVID, in addition to HIV and AIDS. And I think, you know, it's an opportunity. This is an opportunity. I mean, for us as a community to talk about these issues and to say, all right, this is really bringing a lot of things to the surface that we have not dealt with. And, you know, I guess I'm hopeful that this is a marathon. This is a long conversation, the connection between racial justice and, you know, on health issues, for sure.
Yeah, and I think we have to think about this in terms of economic justice as well. And you know, again, you know, despite the availability of these interventions, they're still very expensive. We still have people in our country that don't have health insurance that will pay for it. And again, I think it requires this really kind of this very big paradigm shift to realign our priorities in terms of how we think about accessing proper health care for all American citizens, right? You know, I think, you know, we can add this sort of healthcare debate as a part of this sort of racial economic justice piece. And we haven't done it before, but I think it is time to sort of articulate that in very explicit ways.
Yeah. That's really, thank you. I'm trying to see if I have some questions from online. I'm trying to navigate Zoom, questions online. Wow, okay. I have a question for Professor Greene before we move on to part 2 here. What could be some of the roles of academic institutions like Bowdoin in dismantling systemic racism? Is there a place for academia in the fight for racial justice, especially given how elite institutions like Bowdoin and other colleges here in Maine, we can name them, have served to perpetuate racial disparities? And what are some of your hopes for academia post-pandemic? That's a pretty amazing question.
That is amazing question. It's a big question. It's a question my students have been asking for the past couple of weeks. And, you know, it is very important to remind ourselves that colleges and universities, a lot of them are white spaces and white institutions. And there are lots of big and small ways in which, you know, again, white supremacy is reproduced. But we are seeing, I am emboldened, right, by the fact that, you know, colleges, universities around the world are taking a stand for racial justice. And I say, what I've been saying to everybody is thinking about the fact that the fight for racial justice and equality for all is something that is fought not just by go out and protesting the streets, but it's fought every day. And we have to be mindful of, you know, the everyday ways in which we reproduce racial inequity and you know, prejudice and discrimination, et cetera. How our own you know, sort of implicit biases shape our interactions every day. And so I always pose that question. Academics can play a huge role. And like everyone else, like once the protests die down, then what do we do? And that is, we continue to fight in these sort of small ways every day. I do it in front of the classroom, teaching students. I do that, you know, encouraging students to speak up when they see or hear these kinds of racial things happening in everyday interactions. And I think that is the way in which we really are moving the pendulum forward in terms of fighting for racial justice. It's more than simply researching it. It is being able to put that research into action.
Yeah, thank you. I think that's really helpful. Thank you for responding to that live question from online. So just reminding folks that if you do have questions for our guests, you can use the Q&A function in the Zoom. And if you're on Facebook, you can type in a little comment there and we'll try to get to them as much as we can. I think that's so important, Theo, to recognize that there's a lot of urgency and energy right now, and that is tremendous. And we, you know, we encourage that, we participate in that, and we support that. But this is a very big conversation that's going to happen in multiple places, whether it's at EqualityMaine, whether it's at Frannie Peabody or at Maine Medical Center or in academia. I think there are so many different places where we really have to think about the long game. Yes, focus now on the energy, what's going on now, but this is a big, long conversation.
Absolutely. And one of the things I always say is that, you know, especially for my students, you know, teaching in Bowdoin in this very privileged space, my students can go to spaces where I can't. You know, they can talk to people and access communities that, you know, I'm not able to. And being able to share that knowledge and be able to pass it on and be able, again, to speak in those spaces and push that pendulum forward is a really vital strategy, I think, for fighting stigmas across all sort of categories of inequity and inequality. And so I think that's something we all need to take on. It's collective effort that happens every day.
Yeah, that's great advice. I think does a lot of things. Some of us are like, all right, what can I do? But that's a very sort of very tangible thing for folks to do, is use your privilege in the circles that you exist in. I think that's really great advice for sure. I'm gonna sort of slowly switch and invite a couple more guests onto the conversation. So we're gonna be bringing Skip Brushaber onto the call and David Johnston onto the call, and I'd like to introduce them, and hopefully their pictures will show up when I do this on the Zoom like it's magic. So Skip is a retired nurse and social worker. He has been out as gay since 1971. Wow, I was only 4. Moving to Portland in 1980 from New York State, he was one of the founding members of the AIDS Project and one of our paper collective. He is a published writer and artist. His current passion is hunger and food insecurity, which is so important. He is on the board of directors of the Westbrook Food Pantry, which serves about 400 households monthly. He lives with his husband, 2 rescue dogs, and 1 large tuxedo cat in Westbrook. So we're happy that Skip is joining us. I hope Skip is joining us in a minute. I know we're having some technical things. And then also joining us is David Johnston. David has been living with HIV for 35 years. He has served on the boards of several organizations, local and statewide, and serves the HIV positive community. He currently serves on the HIV Advisory Committee in Augusta and lives in Hancock. And so got to welcome Skip and David into our conversation. And so, David, I know you've been in this movement for many years, decades, I would say, and you're a living testament and a survivor. And I think but last week was actually Long-Term Survivors Day, was last Friday, to recognize folks that you can live. So David, if I could bring you into the conversation and talk a little bit about what it's been like for you in the last 3 or 4 months as an active member in the HIV and AIDS community, and what are some of the things you're hearing from your community members and who've been around for long enough to know and survive HIV and AIDS, and how folks are interacting with the COVID crisis?
Although the diseases are very different, emotionally it's brought up, the COVID-19 has brought up a lot of the same emotions that I experienced in the late 80s and early 90s, when it seemed like it was really hopeless. There was really nothing you could do. There were no drugs that really were effective. People were dying. And a large part of America didn't really care. They just wanted to go about their normal everyday lives. They didn't want the fact that this was affecting a lot of people interfere with their everyday life. And so it's been difficult that way. And I'm a part of a small HIV support group here in the Ellsworth area. And we used to meet in person every Tuesday, and now we're doing it by video conference, but it's just not the same. There's that lack of feeling of warmth that I depend on from that group. I mean, we all talk and discuss and whatnot, but it's still not the same. We can't hug, or we can't really feel the emotion as much as if we're in the room. And hopefully by July, we're going to be able to start doing some of that again. But our meeting room is very small, so I'm not sure how that's going to work.
Yeah, no, I hear you. I think that's one of the themes here is just this. It's really hard because we really crave that personal human contact with one another. And it's really hard to do that. And I'm glad you brought up the sort of the difference in how fast and people responded. I know we talked earlier a little bit about, I think it was 2 weeks ago, the New York Times had published like a long list of thousands of people who have died in COVID. But I think you mentioned something about how long it took the New York Times to talk about HIV and AIDS. Yeah,
the New York Times didn't publish, when 100,000 people had died of HIV, it appeared on page 18 in the New York Times, and it was basically a little tiny paragraph. And they didn't mention anybody by name, and they didn't really, it wasn't a sympathetic thing at all. It wasn't like a great tragedy as where it was for COVID-19. You know, they didn't even put that on in their paper until the January of 1991. So, you know, a long time after the crisis had started.
Right. Right. Yeah, I know. And Skip, I'd like to, we got you online here now. We got to see your face. So I'm glad you're here on the call. I'd like to ask you a little about, you've been part of this work for such a long time and part of founding member of the AIDS Project. So how have you been feeling as COVID has been, you know, with us now for 3 or 4 months, but then all of a sudden we also have these other, you know, demonstrations and riots and protests on Black Lives Matter. This is sort of I don't know if it's a flashback, but there's certainly a lot of things probably going on in a lot of people's minds and emotions and feelings who've been part of this work for decades. How about for you?
It certainly has brought back a lot of memories, as David talked about. I think there's a lot of similarities. It is a different virus. It acts in the body in a different way, but I think the similarities that I found that really are disturbing for me is the federal government's failure to act during HIV, and I found that they have not acted fast enough on the COVID virus. And I also feel that they're tied up, both the response or lack of response to HIV and COVID are wrapped up in For HIV, it was homophobia, it was race, it was class. There was definitely those things because the people that were most affected were gay men, and early on it was Haitians and IV drug users. And so it was all about homophobia and race and class and the lack of response. It was that idea of being dispensable. And I'm now in my early 70s, and I found that when people started talking about that people my age should be willing to die to save the economy, and that, you know, we've already lived our lives, it brought me back to being a gay man in the beginning of the AIDS epidemic and how we were dispensable. I truly believe that's why the government did not respond quickly to the HIV epidemic, is because we were dispensable. And so that brings back those unpleasant memories and the sadness around it. And the response, you know, we're in the streets for Black Lives Matter, but we're in the streets because of a lack of government response to a crisis. And ACT UP did the same thing. And so yeah, it brings back a lot of memories, and a lot of it is very painful. So
yeah, so while I have you there, Skip, for a second, so what do you think? You know, we learned a lot, though. I'd like to think there was some lessons learned over the last 30, 40 years on how we respond to things and how do we support our community members, especially our most vulnerable. Skip, what do you think
well,
about?
I think the response, I was part of there was a few small groups that got together that formed the AIDS Project. It didn't just form as the AIDS Project. And basically we were grassroots. You know, we would go get a name of a person who needed something, needed a ride to the doctor, needed dinner, needed their dog walked, whatever they needed, and needed their apartment cleaned, whatever they needed, and we would go do it. It wasn't a big formal thing. It was out of a bookstore called Our Books, which Fred Berger had for many years. And yeah, and the community response, I mean, how it took off, and the support that we had from people outside of the gay community. I always am very quick to talk about the women's response to PWAs, to people with AIDS. Without women, we wouldn't have had the system and the care and the volunteerism. And unfortunately, a lot of that got erased from history and happens often. And I was part of a buddy training through Mary Meetings AIDS Support in Brunswick. And in my group, I think there were 12 or 14 people. I was the only gay man. There was another straight man, and the rest were all women.
Right.
They were all training to be buddies. And so I really want to speak out about that we really need to recognize that history, that it wasn't just gay men responding to each other, that it was a response that came from a lot of people. So
that's really helpful, Skip. I really appreciate that. How about you, David? What are some of the things that you think you've learned in the community you're part of that we're using today and utilizing today?
I think just being there and reaching out to one another, and staying in touch with people, with your older relatives and older friends who, you know, really can't get out, doing shopping and things for them so that they don't have to expose themselves to the possibility of the virus, much like we did for our positive peers in the late 80s and early 90s. And speaking along the lines of the women, Down East AIDS Network, which later became Health Equity Alliance, was founded by two lesbians. So they're the ones who really put the impetus here in Hancock County and got us all started.
Yeah. David, do you want to mention the U=U campaign?
Well, the U=U campaign is undetectable equals untransmittable, which means that a person who is HIV positive and takes their medications and maintains an undetectable viral load cannot pass the virus on to their partners sexually. The Maine CDC has finally accepted that, and they're in the process of making posters and doing some informational brochures about that. But just about the time they were getting into that, COVID-19 struck, so it's sort of been pushed back, and we're not exactly sure when those posters and leaflets and whatnot will be available, but hopefully soon.
Yeah, thank you. Thank you, David. We're getting near the end of the program, if you can imagine that, at 4:51 on this Tuesday afternoon. I do want to, any final thoughts from folks or things that you want to make sure that our community hears about any of these topics, whether it's HIV and AIDS, COVID, or race, or that combination, that you want to make sure you have I'll give each of you about 30 seconds to sort of plug one more thing. And so, Tiffany, do you want to add something to the conversation before we check out for today?
Yeah, I'm glad that David brought up the U equals U, but I would say that, I want to stress what you said earlier in the program, Gia, about seeking care. If there's anything that you need from a mental health perspective or a physical health perspective, that, the medical care is opening up, and seek the care, reach out to the folks that can help you with that.
Great. Thank you, Tiffany. Katie, how about you?
Yeah, I would just recommend National Minority AIDS Council is a really great resource. They put together the National HIV AIDS Conference, and they're just a wonderful resource, especially to look at the intersection of race and HIV and AIDS. The second thing I would say is, if you need an HIV test, the Maine CDC has allowed us to do home test kits, so we can mail a test kit to you and walk you through the process. And we're also doing curbside testing, so please go to our website at peabodycenter.org and give our prevention phone number a call if you need any of those services. And in terms of the intersection of COVID-19 and HIV, if you're on Facebook, follow Peter Staley, who is an instrumental member of ACT UP. His commentary is always incredibly informative, but particularly now with what's happening with COVID and his experience in ACT UP, he's been a wonderful resource for me personally, and I think he's a great person to follow.
Great, thank you, Katie. David, do you have one last thing to plug before we move on? No? That's okay. Thank you for joining us, David. Skip, do you have one more thing?
Yeah, I just had a quick thought. I remember early on I happened to be in nursing school at the time that the AIDS epidemic hit Maine, and I was on the floor doing clinical for our first patient who passed away in Maine. But I was also doing volunteer work with the AIDS Project. And the one thing that struck me that's similar with what's going on right now with COVID-19 is that people initially did not take it seriously. And there were a lot of people who did not practice safe sex because they didn't think it would happen to them. And I think the same thing goes with this virus today. There's a lot of people who aren't taking it seriously and aren't protecting themselves, and especially not protecting others by wearing a face mask. Yeah. So I just wanted to put in that plug because I think it's even worse now because we have social media, and so a lot of misinformation gets spread very quickly. And it's a very serious epidemic, and we need to protect ourselves and others.
Great. Well, thank you, Skip. And lastly, Theo, I'm going to come back to you. I'm going to let you close this out. What are some things that you think we should be considering and thinking about moving forward?
Yeah, I think about, even in this conversation, as we are in Pride Month, about the various ways in which all the currents, not just COVID, but I think all of these Black Lives Matter marches really are connected in a lot of ways to the history of LGBT people, right? Pride is a celebration of, a riot about police injustice. The same way we can think about, the ways and the intersections, as we talked about today, between COVID and the AIDS epidemic. And I often go back to the ways in which the original intent of the gay liberation movement that Stonewall sparked was the recognition of all of our struggles being interconnected, and the belief that fighting for one is fighting for all. And I hope that these conversations can get people to think and realize about the interconnectedness of all of these inequities, and that we should be mindful of that as we engage in our advocacy, as we do the little and big things, I think, to make the world, kind of what we want to live in. So I will just leave this at that.
Well, that's a really, really important message. Thank you, Theo, for that. And this, I didn't even mention it was Pride Month, but you're right. It's exactly, what our goal is, right? We're not free until we're all free. Absolutely. Thank you to our guests today. This has been a really important conversation. Thank you, Tiffany and Katie and Theo, David and Skip for being with us today. Thank you for everyone Zooming online and joining us live on Facebook. Really appreciate your participation in our series. We're going to have another one next week. Let's look ahead. Tune in next week for our show titled Love and Pride, a discussion about navigating love and relationships in difficult times. So please, follow up with the resources that we talked about today. And if you are needing medical care or you need to get tested, please do. It's really important you take care of ourselves and check in on your friends and your neighbors and community members. That's it for us today. Thank you again, everyone. Have a good rest of your day. We love you.
Thank you.